Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in. I used to always do that with my beginning of the podcast. I'd be like, Tempe. It was Chandler. Protea Medical Center in Chandler, Arizona. Anyway, I love doing this. It's fun. It's fun. This is Saturday here in Arizona, and it's wintertime, and it's like my favorite time of year is this time of year because it's cool out and it's nice. Anyway, before we get started, please scroll down. If you're on our platform, we generally are always on. Well, our primary platform is YouTube, but we're all over the place. But still, wherever you are, I'm sure there's a subscribe button. Do me a favor, click on that, and we can get started. Today, we're going to go into the treatment of menopause, and this is so controversial, but also it's so awesome to do. Controversial because there's so many strong opinions out there. And awesome because when you get it right, man, the woman in front of you, it's a life-changing event. This is what I'm here for. This is what I'm all about. I want to say the controversy stuff I don't like. I don't like the arguments that go into this. I don't like the argumentative nature out there in medicine where people get very much like wrapped up and things. And Justin and I had a discussion earlier about this, before we started shooting today, about how we're trained to be scientists. Every doctor is actually by nature a scientist. And the scientist is trained to look at things with curiosity, not judgment. It's too easy for a doctor to flip into the mode of like, that's garbage, that's junk, that's not real, this is bad science. That's not necessary. But they say it in such absolute terms and they don't explain why. That's not science. Why I'm saying this is because when a doctor tells you that these therapies are unnecessary, they're bad, they're dumb, they're dangerous, they're not regulated, they're not recommended, blah, blah, blah. They say it with absolute confidence. With that said, they never tell you why. They never take a moment and even try to explain why. Here's the hard part for me is because as a scientist, if I think something's not right, if I think something is wrong, if I think something could be done better, I'm going to tell you why. I'm going to explain to you the process. I'm going to explain to you the science behind it. I'm going to do it in a reasonable way. And you're not paying me. You are paying a doctor when you go there. I mean, your insurance company is, or maybe where you are, you pay for it. Wherever you are around the world, we're all different. But that person is supposed to explain to you why. And when they don't, you should be suspicious because no longer are they behaving like a scientist. And that is the foundation upon which you practice medicine. Everything I'm going to say today about the treatment of menopause is scientifically supported. Every single thing. If a doctor were to refute what I said, they would have to prove my science wrong. And I welcome that. We always want to welcome people to challenge the concepts we work with because that's the only way we become better. Shutting them down doesn't. We are led in a very bad direction that way. And so many of you are living that right now. The way your menopause has been treated is absolutely unforgivable in my mind because we know better. We know better that they still treat you this way. So hopefully this helps you. Hopefully this gives you tools to understand why you're going through what you're going through. And hopefully it gives you a language you can use when you speak to your care provider, when you request better care. So let's start with the treatments. But even before I do that, let me talk about the fear of treating, because that's a real thing. There's a lot of fear out there about treating menopause. There's a great book, and I'm not going to even try to duplicate her information here now. It's a great book called Estrogen Matters. I recommend you read it as a woman. I recommend you read it because this is your body. This is your life. And I want you to become as educated in material as possible so you can make educated decisions. But she talks a lot about estrogen and dispels a lot of the fears around estrogen. I'm going to only do a few today because I don't need to duplicate her work. Let's do a couple. Okay. One of the things is that we know that excess levels of estrogen are not a good thing, or unopposed estrogen is not a good thing. Too much estrogen in your body, excessive levels of estrogen in your body, unopposed, is not necessarily good for everything from the lining of the uterus to breast tissue, etc. But the concept is that if you have too much estrogen, it's stimulating things to grow. You have a higher chance of developing cancer. Now, I want you to know this is an incredibly nuanced thing I'm about to say that's easily misconstrued. So I'm doing my best not to let it be worded in a way that is misconstruable. I don't know if that's a word. Unopposed estrogen can trigger cancer, can contribute to cancer's production. Yes. That doesn't make estrogen bad, because estrogen is not the fault of this. It's the lack of progesterone. It's the lack of ovulation. It's the lack of balance that goes in there with the progesterone. Please know this. Bioidentical estrogen in and of itself is not necessarily a good thing when it's done by itself. There's a good article published by Gynecologic Oncology. And it's a little bit published a little while ago, but I thought it was an important one to bring into this. It was titled Hyperestrogenism, a Relevant Risk Factor for Development of Cancer from Endometriosis. And the idea they're talking about, tissue that's been overstimulated by estrogen, having excess estrogen on top of that is not a good thing. So when there's a fear of estrogen with cancer, I want you to know it is rooted in something. Okay? It is rooted in something. But it's taken out of context a lot of times, way far out of context. Here's 2 examples. One is, yes, estrogen in and of itself, by itself, as I just mentioned a moment ago, is not safe. You're not supposed to have it in and of itself, by itself, on itself, by it there. And I mean, how many women who had an ablation or had a hysterectomy are put on standalone estrogen by itself? That's pure laziness, by the way. And if your doctor does that, they're not really being a good doctor. So estrogen prescribed as a standalone therapy is never good, ever good. Because you are not just a one-note person. There's more to you than that. Too much of one thing is always bad. Always bad. Never good. Balance is there. Always. You have to understand the woman in front of you. Always. That's why previous episode, lab work. What else? When you give a woman estrogen, why is, estrogen, the cancer thing, the second part is going to be that synthetic estrogen is not the same as bioidentical estrogen. The estrogen that we get from a horse's urine is not a woman's estrogen. The estrogen that we made more potent in a lab is not a woman's estrogen. Synthetic estrogen is not the same. It overstimulates tissue. It's going to have a problem with it. It always has and always will. So I want you to understand one of the fears with estrogen with cancer is largely misstated, misunderstood, totally unhelpful. What else? Another one that's important, and they don't talk about this, but I do. This is my life. This is what I do. Fears, and no one. I'm going to give you more fears about this. Sorry, this is because you probably never heard of these things I'm about to say. But conjugated equine estrogen or synthetic estrogen does increase something called C-reactive protein, and that's an inflammatory marker your body makes. It's not good for you, not good for your heart. Bad to take. So conjugated equine estrogen, synthetic estrogen, does have a higher risk for developing heart disease. But I want you to know the C-reactive protein elevations are also associated with dementia. So conjugated equine estrogen or estrogen that comes from horse urine, not good. Synthetic estrogen, not good, because the C-reactive protein goes high. When we use bioidentical estrogen, on the other hand, you'll see C-reactive protein levels always go down. That's been proven. And that was a great study that was published in the Journal of Fertility and Sterility. And there was a venous thromboembolic events and oral estradiol dosage. So that was kind of cool. But there's enough studies out there that show that providing someone with estradiol does not have the same effect. And again, there's a misnomer in here. I want to make sure I'm clear. Step back for a moment. That slide that I just wrote in that article, topical, transdermal, or injectable, same method of delivery, because it goes through skin or inject, different than oral. When you do oral estradiol, you do have a higher risk factor for cardiovascular. The topical or a transdermal does not. It's very important. We'll get back to it in a little bit in a minute. Other fears about the heart and cardiovascular disease and hormone replacement therapy goes to medroxyprogesterone acetate, which is synthetic progesterone that often gets added to hormone replacement therapy for women postmenopausal. And medroxyprogesterone acetate is just trash. It's just not healthy. It is not a good thing. I want you to know that has more problems associated with it, with cancer, has more problems associated with inflammation, more problems associated with dementia, more problems associated with, in this case, cardiovascular disease. Because if you have a woman who's taking estradiol and medroxyprogesterone acetate, they have a higher incidence of heart disease. But if you give the same woman estrogen and bioidentical progesterone, which is oral micronized progesterone, you're better. So synthetic progesterone, and when it comes to its impact on the heart, synthetic progesterone is not a good thing with atherosclerosis, etc. Another fear change is kind of a big thing in here with women is dependence. And that's important. When someone starts hormone replacement therapy, if you're using synthetic, you should always be on it for a very short period of time. You should never stay on synthetics for very long because of the risks and the dangers, and it's not safe. Bioidentical, is that safe? Can you stay on that long term? I'm going to say that I know there's a lot of people that argue with me on this, but I'm going to say it is very clear to me, yeah, you stay on it for life. This is part of your identity as a woman. You're meant to have this. We keep this here. We run the labs to verify. We keep it in a safe range. I am of that school of thought. With that said, when women come in, does this mean I'm dependent on it? If I stop it, what will happen to me? If you start hormone replacement therapy postmenopausal, and you're doing this to treat menopausal symptoms, if you stop abruptly, you will feel horrible. This is never a good thing to do. So, the dependence is kind of a weird thing. When you put something in your body that has that much of an impact throughout your system, everything from brain chemistry to mood to every aspect of biochemistry, these hormones are important. If you were to abruptly remove them, you're going to destabilize the woman in front of you. So you should never abruptly withdraw. That doesn't mean that you're dependent on it. You can slowly lower the dose and taper someone off of it. You will still not have the same quality of life, though. You were made to be a woman. That's who you are. That's your identity. If you take these hormones out of your body completely, that's not what your original blueprint is. So if you take these hormones out of your body, the benefits of these hormones across the body are not going to be there. So you're going to go back to where you were before without them. And that's a choice we all make. You have to make that choice. That doesn't mean you're dependent on it. It just means you're not going to just start making estrogen again. This is not something where I'll just take estrogen for a little while, then I'll get better. There's no getting better. This is just what menopause is. You're not going to have these hormones anymore. And without the hormones, your life is this. And with them, it's this. If you abruptly stop them, you're going to feel terrible. You abruptly increase them, not good either. You have to know what you're doing. And that's the dependence part of it. So I'm going to turn this into 2 episodes right now because this treatment takes more. And I need to, the next one, we're going to go into treatment, and I'm going to talk about the different delivery mechanisms, which is super important for you to have that information. So we're going to divide this into 2 parts. This one was about a little bit about the fears associated with it, because that is important, because there's a lot of misinformation out there, and the more data you have, the better. And by the way, all the studies I just kind of cited, I will put them in the notes section. So if you're on YouTube, you will see in the comments section, in the description. In the video description, you'll see all the research I cite with this, because it's important you have that research. I'm not some madman on the internet just talking crazy. I'm giving you the data points, okay? The next episode, we're going to go more into the treatment. We're going to different delivery mechanisms, the risks and benefits of each delivery mechanism. And then from there, we will hopefully have, after that, a question and answer that we do at the very end. And that'll be after we've released this series. We watch for your cues, your questions. We want to give you as many answers as possible. We'll make an episode of that. After that, we'll go into the next series. So thank you so much for tuning in, and I'll see you at the next episode.